In this video, Medicare Informatics would like to share information about proposed payment policy changes for Medicare Advantage and Part D drug programs in 2023, which is released by the Centers for Medicare Medicaid Services on February 2, 2022. In this presentation, you will see the expected impact of the proposed policy changes on MA plan payments relative to 2022, and how the risk adjustment models will be updated in 2023. Finally, several potential measurement and methodological changes in measure-level performance of star rating. This table indicates the expected impact of the proposed policy changes on MA plan payments relative to 2022. In a fact sheet, CMS said that it expects Medicare costs to grow by 4.75% in 2023 compared to 2022. MA plans will see a 7.98% change in revenue. The average increase in risk scores will be 3.5%. For calendar year 2023, CMS plans not to update the years in the trend because of concerns that the changing use of services in 2020 because of the COVID-19 pandemic resulted in an anomalous 2021 risk score, which will result in a projection that significantly underestimates what the 2023 risk score is likely to be. Also, CMS proposes to apply a coding pattern adjustment of 5.9%, which is the minimum adjustment for coding pattern differences required by statute. CMS will continue the calendar year 2022 policy to calculate 100% of the risk score using the 2020 CMS HCC model, which was phased in from calendar year 2020 to calendar year 2022. It will continue to calculate risk scores using diagnoses exclusively from Medicare Advantage encounter data submissions and fee-for-service claims. However, CMS does want feedback on whether the CMS HCC risk adjustment model can be improved by addressing the impacts of social determinants of health on beneficiary health status by incorporating additional factors that predict the relative costs of Medicare Advantage enrollees. CMS uses a separate model to calculate the risk scores applied in payment for the Part A and Part B benefits provided to beneficiaries in ESRD status when enrolled in Medicare Advantage plans, Program of All-Inclusive Care for the Elderly organizations, and certain demonstrations, including Medicare Medicaid plans. CMS intends to implement an updated version of the RxHCC risk adjustment model used to adjust direct subsidy payments for Part D benefits offered by standalone prescription drug plans and Medicare Advantage prescription drug plans. The recalibrated model includes an update to the data years using the same approach CMS uses to filter diagnoses from encounter data records for risk score calculation, including the risk adjustment allowable CPT/HCPCS codes. In the advance notice, CMS provides information and updates in accordance with the star ratings regulations. Additionally, CMS is soliciting feedback on a number of different potential measurement concepts and methodological enhancements, including the following: plans to enhance current CMS efforts to report stratified Part C and D star ratings measures by social risk factors to help Medicare Advantage and Part D sponsors identify opportunities for improvement. The development of a health equity index as an enhancement to the Part C and D star ratings program to summarize measure-level performance by social risk factors into a single score used in developing the overall or summary star rating for a contract. The development of a measure to assess whether plans are screening their enrollees for health-related social needs such as food, housing, and transportation. How Medicare Advantage organizations are transforming care and driving quality through value-based models with providers to use in the potential development of a Part C star ratings measure. Please contact us if you would like to implement the risk adjustment score calculation solutions in your environment. Thank you for listening.